In May 2026, the MV Hondius, a polar expedition ship, found itself drifting off the coast of South America. Inside, passengers were falling severely ill, and 3 people had already died. Coming out of the long shadow of the early 2020s, health agencies naturally braced for the worst. The immediate assumption was that another highly contagious, novel superbug was sweeping through the ship's closed ventilation system. But when the lab results came back, they revealed a pathogen that rarely makes headlines and almost never appears at sea. It was hantavirus. A pathogen strictly known for lurking in dusty rural barns was now circulating through the pressurized, highly sanitized decks of a luxury liner. To understand why this was so alarming, we have to look at how this virus normally operates. This diagram illustrates the standard transmission route. Humans typically contract it by inhaling aerosolized particles that rise from infected rodent urine, saliva, or droppings. Because of how it spreads, infections are almost entirely confined to closed, rural spaces where wild rodents and humans overlap, like a farm shed or a remote hunting cabin. You do not expect to encounter those conditions on a thoroughly scrubbed polar expedition ship navigating the freezing waters of the South Atlantic. The outbreak broke the known biological rules of the disease. For investigators, that meant one of 2 things. The environment had radically changed, or the virus itself was behaving in a completely new way. Epidemiologists traced the likely exposure point back to a shore excursion. Before boarding the ship, passengers had hiked through dense rural forests in Argentina and Chile, prime environments for rodent contact. This cross-section shows the infection taking hold. Patients rapidly develop hantavirus pulmonary syndrome. Lungs quickly fill with fluid, leading to severe respiratory failure and shock. Severe cases carry a massive fatality rate, reaching 30 to 40%. Laboratory tests of the sick passengers soon confirmed an even more alarming detail. They were infected with the Andes strain of hantavirus, one of the very few variants known to occasionally spread directly from person to person through close physical contact. With the Andes strain confirmed, the gap between the forest and the ship closed. A few initial exposures on land could now easily ripple through a tightly packed manifest of hundreds via close physical contact. By the time the ship docked, the threat had multiplied. The manifest dispersed on flights back to Europe, North America, Australia, and Asia. The major challenge is the incredibly long incubation period. Infected passengers can cross time zones and go weeks without a single symptom. This massive delay triggered a coordinated response from the World Health Organization, launching an international effort to track down and monitor every individual who had been on that ship. On the ground, this required activating strict long-term quarantine protocols and deploying healthcare workers to implement thermal screening at major international transit hubs. The true stress test of the global health system wasn't rapidly sequencing the genetic makeup of the virus inside a laboratory. It was enduring the agonizing, borderless waiting time dictated by its biology. When headlines about a deadly virus and isolated cruise ships hit the news, public anxiety spiked. But biologically, this pathogen operates very differently from highly contagious respiratory viruses like COVID-19. Even the Andes strain does not spread casually through the air in a grocery store or airport terminal. Human-to-human transmission requires intense, prolonged close exposure, naturally limiting the scale of secondary outbreaks. The World Health Organization maintained that despite the severe symptoms of the infected, the broader risk to the global public remained extremely low. While a global hantavirus pandemic remains a remote biological possibility, the immediate travel bans and market volatility surrounding the hantavirus suggest the memory of 2020 continues to shape international policy. As the immediate crisis was contained, epidemiologists looked back at regional data and found a severe spike in hantavirus cases across Argentina in the months leading up to the cruise ship's arrival. This heat map reveals the underlying ecological cause. As local temperatures rise, expanding heat zones allow rodent populations to survive in new areas, forcing migration into human-adjacent territories. As habitats overlap, more frequent animal-to-human interactions make isolated exposures statistically inevitable. The events aboard the MV Hondius reflect a shifting planetary ecosystem colliding with a highly mobile global population. A warming planet is pushing established, deadly viruses out of the forest,